In Good Health, brought to you by McLaren Northern Michigan.
Pain of the spine, whether it be back, neck, is one of the most common ailments that an adult will ever have in their lifetime. My name is Justin Thomas, and I'm a neurosurgeon at McLaren Northern Michigan. In the normal adult spine, you have 24 vertebral bodies and 23 intervertebral discs. And each disc basically acts as a shock absorber or a spacer, and it also allows for the spine to be mobile so that you can bend and twist and lift and do things that your spine normally allows you to do. As you naturally age and as the disc loses its water content, it eventually goes bad on you. And when it goes bad on you, basically that results in a disc herniation often. If the disc herniation presses on a spinal nerve, you'll often have pain and sometimes weakness that's associated with it. And then if it presses on an area of the spinal cord, it's often much more severe and you have different parts of your body that become weak as a result of it. Maybe not so much just one single nerve. So for patients who fail conservative management, we have a number of surgical treatment options for herniated discs. Ideally, the most straightforward approach is that you just are able to remove a small fragment of the offending disc herniation that is irritating a nerve. However, a number of times we're not able to necessarily do that, or the problem is a little more complex. And in that situation, just removing a small disc fragment may not necessarily be the full treatment for it. So when we look at a patient who needs a potential surgery for a disc herniation, we look at the overall problem and we try to achieve the best outcome for the patient with a surgical approach. We do have a number of surgical approaches for the lumbar, thoracic, and cervical spine, and all of them utilize a combination of traditional open approaches or minimally invasive approaches. What I'd like to be able to offer my patients, particularly in the lumbar spine, is when I can, we will often do surgery through a small tube that allows us to surgically address the problem and then also fuse the spine if we need to, and only if we need to, so that we no longer have a problem at that level. Now, that doesn't necessarily mean later on you can't go on to develop problems at other levels, but if we're able to treat the pathology with a minimally invasive approach, I will always offer that for my patient.
For more information or to schedule an appointment, go to mclaren.org/northern or call 800-248-6777.